Some mothers attest to the severe pain they had when it was time for childbirth, going through labor pains. Labor pain is different from any other pain. When I was experiencing it, my back would hurt so much. I had severe stomach ache. I could not bend at all or even stand straight. I experienced labor for 3 days. Dr. Muhumuza Sam, an anesthesiologist at King Faysal Hospital, explained that the epidural, also known as labor anesthesia, is the best method that can be applied for any woman planning to give birth, even though there are other ways to relieve pain. When we give the epidural, the mother continues in labor but with no pain, but she feels the pressure, and we follow up on her. The midwife follows up on the dilation of the baby, and when it's time for birth, she will be taken to the labor ward. And it's not to say that she doesn't feel anything. She feels the baby and the pressure, but she feels no pain. Dr. Deyemi Olufolabi, an anesthesiologist at the Duke Global Health Institute in Durham, says that the epidural analgesia was developed by health experts after it was discovered that labor is the most severe pain a woman will go through in her entire life.
Many studies on this. When epidural started, the type of medications they gave was very strong medications, which interfered with labor. It slowed labor down. But nowadays, we use very, very light medications, which, as far as we know, most labors are not interfered with. And if you look at the WHO statement on epidurals, it says that labor progress is not interfered with. In the second stage of labor, some women have even actually experienced faster deliveries than slower deliveries, because when you have severe pain, some women cannot concentrate. They are like paralyzed with the pain. But with labor analgesia, we have found out scientifically in more recent papers that labor is even shortened in many women, and they actually have this experience in a very positive way.
Dr. Abdul Namugongo, a gynecologist, says that in addition to reducing pain, it also reduces the effects brought about by delayed labor for both the mother and the baby.
When somebody is bringing life into life, why should they suffer having the pain? The advantage of having an epidural is that a mother will progress normally in labor without pain, without stress. That's the biggest advantage of epidural. And when it comes to, there are some things mothers do because of pain that affect the baby and they themselves, mainly contributing to a baby getting tired during the process of labor, a mother getting complications of bleeding resulting from the acts they did during labor because of pain.
Amina Nyiranteziryayo, a psychologist, says that severe pain during childbirth is not an indication that the mother will love her baby. When we talk about maternal affection, or the love a mother has for a child, it's different from the love she has for others. It is the love a person has because of being a mother based on the hormones it carries when a person is pregnant, the bond they create when the baby is moving on the inside, and breastfeeding when the child is born, the face-to-face contact, all that forms a love mother and child share. At King Faysal Hospital, between 120 and 150 women give birth per month. Of these, 60 and 70% give birth by cesarean section, mostly due to the labor pains experienced. Reporting for RTV, Gloria Mutesi.